to ask you, what is dementia?
So dementia is actually a very broad term. It describes the characteristics of the symptoms of like decreased cognitive behavior, trouble with like, problem solving,
Hi, my name is Alina Kareem. I'm the Program Director's Assistant here at Sahara Home Care, and I'm with...
Hi, I'm Dr. Abbas. I'm a third-year internal medicine physician at Grady Hospital.
And he's going to be discussing dementia and what effects it has on our clients. So if you want to begin.
Sure.
First, I wanted to ask you, what is dementia?
So dementia is actually a very broad term. It describes the characteristics of the symptoms of like decreased cognitive behavior, trouble with problem solving, language, ability to perform basic daily activities. As I mentioned, it's very broad, so there's actually 4 categories, Alzheimer's being one of the types of dementias there are.
Okay, and could you tell me what the signs of dementia are?
Of course. So some early signs include memory loss, difficulty concentrating, confusion about the time or place, trouble completing familiar tasks, or changes in the mood or personality.
Okay. How is dementia diagnosed?
Yeah, so the diagnosis takes some time. It typically involves a detailed medical history, some cognitive tests like an MMI, the physical exam, brain imaging such as like an MRI scan, and sometimes lab tests too, just to make sure there's not something else going on.
All right. How does dementia progress over time?
So there's not, as I mentioned, so umbrella terms. There's not like one way. Not everything fits all for each person, but it's generally like mild, moderate to severe stages. It can worsen over time. It might be some memory loss, but then it might gradually determine whether they can't remember who they are or where they are, difficulty communicating, and depending solely on their caregivers.
Okay, so it's basically like a spectrum of...
Correct.
Okay. So are there any treatments for dementia?
Not quite, unfortunately. There's not really any cure. Medications and therapies can really just help manage the symptoms and improve the quality of life or even the behavior. There are some things like lifestyle things like diet and exercise, and some like or playing Sudoku, some mental exercises that can help slow the progression too.
Yeah, so basically just being active, keeping your
much.
brain active, keeping your body active.
Exactly.
All right. So what should a caregiver focus on when caring for someone with dementia?
So of course, caregivers should focus on providing a good structure on their day in life, like their morning, afternoon, and evening, making sure they're awake during the daytime, sleeping at night, ensuring that they're having safety and promoting independence whenever possible. We find that when patients, go to the bathroom on their own or eat on their own and they're more independent, it tends to help them in the long run.
Okay. How would one communicate effectively to someone with dementia?
Of course, so using simple language, maintaining eye contact, speaking slowly, giving them time to respond, avoid correcting or arguing them. It's better to redirect the conversation.
Okay. How can someone manage difficult behaviors such as agitation or wandering?
So the first thing to do is stay calm, identify what's triggering them, such as hunger, pain, or overstimulation, create a safe environment, a comfortable routine, and engage the person in calming activities. Just consider their well-being before getting triggered by any like agitation or wandering.
Right, because they don't know any better.
Exactly.
So what are some challenges that caregivers face and how can they manage the stress?
So caregivers often can face physical or emotional stress, isolation, and even burnout. I would say the best things to do is when you have like noticing that in themselves, to take a break, join support groups, and just prioritize self-care.
Okay. How can our caregivers prepare for the future?
Yeah, so doing things early, plan for legal, financial, and care decisions, such as advance directives, uh, all appointing a power of attorney, and discussing end-of-life wishes. These are some things that we always deal in the hospital where we don't quite know what the patient
Right.
wanted. So just getting something legally written early on is the best thing.
Just being prepared. How can technology help in caregiving?
Tools such as GPS trackers, medications, reminders, and apps for managing schedules can make caregivers' life easier and improve the safety for those that have dementia.
So, how can we raise awareness about dementia?
So I think this is a great example of what we're doing right now, sharing personal stories, volunteering, organizations, advocating for any type of research or funding that deals with dementia care and treatment.
What advice would you give to someone who is new to caregiving?
hmm So I would say it's really important to be patient with yourself. Focus on building a strong network of friends who are also in the same field. And it's basically a journey, just learning how to navigate it. It's very difficult, and just having a good social support, I think, is the best thing one can do.
So, how can our caregivers establish a daily routine with someone who
hmm
has dementia?
So I would say consistency is key. Having written scheduled activities, such as like when their meals are, when they should exercise, and what time should they have rest. Just incorporating these enjoyable activities throughout the day as
Hmm.
well. Just having like a sense of purpose in their daily life. Um, just basically having a consistency every day, doing the same thing, I would say.
How would a caregiver or family member manage hygiene with a client or family member with dementia who
hmm
resists, bathing and grooming?
That's a good question. So I would say first focus on the approach, having some patience and positivity, explain the process step by step, offer choices like picking the temperature or the soap. If the resistance persists, try sponge baths or turning hygiene into a more like relaxing experience, whatever that may be.
Yeah.
Whether that's like having like their phone or TV by side, just so they can be more
More comfortable.
correct.
Okay. What are some tips for managing meals
hmm
and nutrition for someone who has dementia?
I would say serving small and easy to eat portions
Hmm.
and limit distractions during meals. Finger foods can be very helpful, but definitely watch for signs if there's any difficulty swallowing.
Of
That may be a
course.
reason why
Yeah.
they're resisting food at some point.
Okay. So, how can we encourage physical activity for someone who has dementia?
I would say start with like light exercises such as walking, stretching, or even dancing. Activities like gardening or folding the laundry can also promote movement and engagement in the house
Yeah, so
too.
any small sort of task
hmm
that requires a little bit of physical exertion could help.
Of course.
What can we do to help someone with dementia sleep better at night?
Yes, so I would establish like a consistent bedtime routine. Definitely stay away from any type of caffeine or sugar. Keep the room quiet and dim. Avoid napping during the daytime, and ensure they get some sunlight as well during the day so that doesn't happen. Um, I think all those things incorporated can definitely help them sleep.
Yeah, for sure. How could we handle mood swings?
Yeah, it's a difficult situation. That's a good question. I'd say stay calm, validate their emotions, and avoid arguing. Look for the triggers, what's exactly causing them to be such that way. Is it like they're being overstimulated? The best thing is try to redirect their focus to something else.
Okay. So, how can we support someone with dementia through moments of confusion or fear?
So I would say reassurance is the best thing. Try to maintain a calm tone, physical touch, even if they're comfortable. and familiar objects. Avoid overwhelming them with too much information that could just overstimulate them and make them more
Yeah,
confused.
for sure. So, what could a caregiver do if their client or family member becomes socially withdrawn?
Yeah, I would say that's a good question. I would say start with like encouraging small social interactions first, like visits from close friends or family, or even involve group activities like singing or storytelling, um, whatever is within their comfort level.
Okay. Yeah. What are the main challenges that one may face during the advanced stages of dementia?
Of course, so I'd say the advanced stage of dementia can involve like some mobility issues, difficulty swallowing, and even loss of communications. At this point, caregivers have to give full-time assistance, adapt to nonverbal cues, and work closely with healthcare providers to see what exactly the patient wants.
Yeah, that's fair. So, how can caregivers manage the end of life care with,
hmm
their clients with dementia?
So I would say focus on comfort, dignity, and quality of life. It's best to get in touch with a palliative care doctor that can help manage their pain and provide further resources that can help them, as it's obviously a very difficult time, and comfort would be the most ideal
Of
thing to
course.
do for them.
Yeah.
hmm
All right, Dr. Abbas, thank you so much for answering these questions. I feel like these are really important points to know for caregivers, family members, whoever it is out there that is handling and dealing with someone who has dementia. And we really appreciate your time. Thank you so much.
Of course, thank you for having me.